This is Linda Shrunk, my mom. Strong, beautiful, and always optimistic. She has always been a loving caregiver to her husband and 3 children. She and my father have been married for 19 years. Mom has always been a normal, happy woman, and even after her diagnosis last year, she continues to be as hopeful as ever.
When I was first diagnosed, it was very scary, and I was frightened and cried a lot because it was a scary thing to think about. My husband found out first, and actually found out from the doctor. She called him, he called me, so he knew about it, and then we sat the kids down that night and told them at dinner. My parents, I had to go out and do it calmly because they knew something was wrong because I wasn't feeling good, and they were worried about that happening to me and being diagnosed with MS. And it was hard to tell them because they got very worried and very upset. But everybody else took it pretty well, and we were able to tell everybody slowly, over time.
This disorder affects a person's central nervous system, which is made up of the brain and spinal cord. The body itself starts to attack the central nervous system for an unknown reason and causes the breakdown of the myelin sheath, a fatty covering that protects the body's nerves and helps nerve impulses to fire quickly. This damaged myelin forms scar tissue, or sclerosis, and causes the nerve impulses traveling to and from the brain and spinal cord to become distorted or to completely stop. My mother's life is very different now that she has been diagnosed with multiple sclerosis.
Everything's different. I still do the same things that I did before because I don't have that many symptoms, but I notice the symptoms every day, and I just look at the world differently. When someone's driving crazy in front of me, sometimes I just let them go and ignore it and not worry about it instead of getting angry at them. I have to change the way I clean the house, the way I try not to rush around. I try not to stress myself out as much as I used to. So I do take more time for myself by just sitting down and taking a nap or relaxing, so that I don't get stressed. And this does make you very tired, so luckily my family lets me sleep in on the weekends, and I take advantage of it.
Even though my mother has multiple sclerosis, she has the support of her friends and family.
Still able to do most of the things that she used to do. Thankfully, her attacks seem less severe and occur less frequently than other people with MS, and it's reassuring to her and to our family to know that she doesn't have to worry about being immobile or anything like that for a long time. Sometimes she seems so normal that we forget she even has it, but then I'll see her struggling with a jar when cooking dinner or complaining of pains in her arm, and I remember that she has it.
Madison, can you open that for me? Of course. Thank you. My first one was in 2002, so a little over 10 years ago, and they didn't know what it was at the time because if you have one incident, they can't call it multiple sclerosis. You actually have to have a second incident for it to be multiple sclerosis. But they did check me for all of that back then, and they said I didn't really have a clear case of multiple sclerosis, so they gave me a different diagnosis of transverse myelitis. Then I had an attack in November of 2012, where I had some numbness, and then it traveled down my leg, and when we went in and had an MRI, they were able to confirm that this was a second attack, and that's when they confirmed that it was multiple sclerosis. I still have the symptoms that I have now. On my left foot gets a little sore sometimes. Sometimes I feel like where the plaque is on my spine that maybe someone's pushing on it, so if I get a little uncomfortable, sometimes going to sleep or sitting in a chair a certain way, and I have to adjust. When it gets really cold outside, the numbness around here starts to tighten and gets a little sore, but other than that, it goes away most of the time. And the one that I feel most every day is my three fingers here that tingle and feel numb all the time. I've dropped hairbrushes, I have trouble opening jars and things like that, so I do struggle a little bit with this hand pretty much every day.
Though there is no cure for multiple sclerosis, there are a few medications that can help to slow the progression of the disease. Unfortunately, they do include many harmful and unpleasant side effects, and some of them must be injected. I spoke to my mother's neurologist, Dr. Catherine Kapoor, about the types of treatments available for MS patients.
There are a lot of treatments, and there's a lot more over the last about 10 years. A lot of them have been in development, but several, particularly these oral drugs that you can take by mouth. People tend to separate it now into the injectables and the orals. There's four older drugs really, three of which are interferons. And if you want me to name them, I mean beta interferon. That has another name called Xtavia. It's the same drug though. And then there's Avonex and Rebif, same drug but different delivery systems. And then there's Copaxone, which is kind of the outlier of that group. It's a non-interferon. Then there's the new guys, like someone we know has tried Tecfidera. That's one of the newer oral agents, and it can cause a lot of stomach distress, diarrhea, just pain in the stomach, and then this kind of flushed sensation, which is somewhat unpleasant. Not dangerous, but it's unpleasant.
When I first started taking the medication, this was a new medication. It came out in April, and I started taking it at the end of May. And they told me that I would get flushed red, which I get, and now I take an aspirin every day so that I don't get red in the face and it feels like my ears are on fire. The other one was it can give you gastrointestinal problems. I had some trouble with that, so what I did with that is we just went back to a half dose for about a month, and then I went to 3/4 of a dose after that and worked my way up to taking the full dose. Probably it took me about 3 months to get back to the full dose, and now I don't have any more problems with that. I just realized that life goes on. I've got a family to raise, and I have to be here for everybody, so I just try not to think about it. And I think if you just keep yourself busy, you don't think about it. The only time I do is if I feel funny or if my fingers start to bother me or my foot bothers me, then I think about it, but I just go sit down and relax, and I don't, try not to complain and just go on with life.
This is one of the many lessons I have learned from my mother over the years. She proves that you can stay strong and always stay positive, no matter what life throws at you. Don't dwell on what you don't have. Cherish everything that you do have. You know that old saying, when life gives you lemons, make lemonade? It's a cliche, but it has an empowering and inspirational message behind it. I believe this is my mother's unspoken motto, to use something negative and turn it into something positive. There will always be lemons in your life, so be strong and make lemonade.